We are really now, for the first time, seeing the rapid decline of coronavirus cases. In some states, it's down to almost a statistical zero. It's not literally zero cases, but it's statistically low enough where there's really no spread. Most people who are getting sick are not passing it to anyone. And that's how you reduce the number of cases. This is just a good thing. Let's look at the latest numbers, starting with U.S. cases nationally, which have declined now more than 93% from their peak. The peak was 255,000 cases per day in late January, now down, or early January, now down below 18,000 cases per day. We are really getting there. The deaths are fortunately starting to come down with them. Deaths are now down about 87% from their peak, below 500 a day from for the first time since March of 2020. Deaths are at their lowest in about 15 months. Now, is there anywhere in the U.S. where cases are going up? Not really. There are places where they sort of aren't going down anymore, and they tend to be places with low rates of vaccination. So Mississippi is an example where cases have been level for about 10 weeks. They're not growing, but they're not really shrinking anymore. That's not great. They need to vaccinate, but lots of people there don't want the vaccine. It's likely that eventually the places with lower vaccination rates are going to just see continued clusters, while the highly vaccinated states are going to go down to, again, statistically zero, not literally zero, but almost. In terms of globally, in South America, things are not good. And I was just looking at what's going on in my birth country of Argentina, and it's a disaster. But overall, it's not just American cases and deaths that are coming down. Global cases are now declining pretty rapidly from their peak. At one point, we had 830,000 new global cases per day. That's now down about 40% to 485,000 cases per day, down almost half. And then global deaths are also more slowly declining, but down about 25% from their peak. At one point, 14,000 humans per day were dying from COVID. We still have about 11,000 dying per day of this virus. Overwhelmingly, it's happening in the least vaccinated countries, restating, underlining the importance of getting vaccines to all parts of the world. This is not over, but in some places, it will effectively be over soon. More mask mandates are being pulled in states, were pulled over Memorial Day weekend. The vaccines work well against the variants. So it's not time to go crazy and do stupid stuff. I think at this point, we all know what is considered stupid at this point in time. Large gatherings of unvaccinated people indoors is basically the stupidest thing you can do. But vaccinated people can do most things with what we would call baseline risk. And this is a really important concept to understand because psychologically, the pandemic has really shaken up our concept of the risks we accept by existing in the world. Risk wasn't zero before this pandemic. You could go out and you could get a cold. You could go out and you could get the flu, and sometimes people die of the flu. You could go out and pick up a stomach bug through physical contact or in a restaurant or whatever. You could get in a car accident. So the question for me is not when is the risk of COVID zero, but it's when is it low enough that we would consider when I go out, I'm at baseline risk, meaning I'm accepting that generally there's some risk to being in the world, but there's not this acute thing. And vaccines are a huge part of getting back to that baseline level of risk of just being alive and existing in the world. Even staying home, you could fall down the stairs. I get it. Even staying home, you could poison yourself with lead paint. I don't know. But the point here is there are lots of people who before this pandemic were accepting risks by being out in the world that maybe they didn't even quantify. And I think that now, because we're so aware of it, it's going to feel scarier. And like, I get it. I was, the other day at the grocery store, there just before more mask guidelines were pulled, there were already a bunch of people without masks. I was wearing my mask because that was the rules at the time. And I see the people without the mask and it's like, whoa. It's like you visualize a stream of germs coming out of their mouth. We accepted that before, right? For my 30 whatever years that I lived until the pandemic, I accepted that and didn't think twice about it. The question is, when will we be back to that? And then is that an acceptable level of risk? For some people, going back to the old level of risk, for example, a flu, won't be acceptable. And people are going to continue wearing a mask, and that's fine. But it's going back to normal, but it's sort of a new normal where I think all of us are more aware of the risk to just being out in the world. Now, one last thing. Vaccination keeps slowing down in the US, even though there are tons more people to vaccinate. Daily vaccine doses are down to 1.5 million a day. At one point, they were at more than double that, 3.3 million a day. There are tons of people still to vaccinate. If they don't get vaccinated, some are going to get COVID and some are going to die. And many doctors believe that because this is going to keep circulating, if you're not vaccinated, that it's almost certain at some point you will get it. Something to think about. And let's now talk a little more about the psychological impact of this pandemic.